Mental health has surpassed both cancer and COVID-19 to become the most pressing health concern among Singaporeans. Now, that is according to a new study by research firm Ipsos that surveyed over 1,000 Singaporeans aged 21 to 74.
Nearly half of them consider mental health a top priority, and more so than cancer at second place. Stress and diabetes also rank high, but COVID-19 went from being the top concern back in 2021 to fifth in line.
As for the impact of stress on mental health, more than half of the respondents say that it affected their daily lives at least once in the past year. A quarter say that they were so stressed on occasions that they struggled to cope with things. 2 out of 5 had to take time off work.
And for more on this, we're joined by Dr Low Kiang Wei. He's Medical Director, Consulting and Medical Services at International SOS. Oh, Dr Low, your organisation is a health and security service firm. Now, if you look at companies, how would you rate how high they prioritize mental health in their employees? And if they do not rate it very highly, how would you encourage them to put more priority on mental health in employees?
Yeah, good evening and thank you for having me. I think if we were having this conversation about 10 years ago, probably the honest answer would be not very highly. But over the last 5 years or so, we have really seen companies, and especially the larger ones, place more priority on this. And this can be seen by the number of work that we do, that the industry does with regards to mental health. It's not just improving access to mental health services for employees. We are going into things like peer support programs, mental health crisis simulations, and all that. And if you look at the industry itself, the number of new companies servicing this sector, you can see, I think the proof is in the pudding that there is tremendous resources being put in this area by the corporates, by the government and the supporting agencies as well.
Do stay with us, Dr. Low. We will be coming back to you for more analysis. But right here in Singapore, we do see that some employers are, in fact, ramping up efforts to address workplace burnout. The Singapore National Employers Federation says that it has helped over 100 employers to organise mental wellness sessions for their staff.
One insurance company has also seen uptake for mental health coverage jump tenfold since pre-pandemic times.
These people are having fun. While it may not look like it, they're actually working. These company bonding events are becoming more common. And companies say it's all part of ensuring their workers have a healthy body and a healthy mind.
We went to just do some outdoor activities, like those sort of high elements, rock wall climbing, so to ensure that there is the sort of physical activity. So one part of health is, I think, the physical part. The other one also is about the connection.
The company believes that bond could be a key respite for employees who are stressed out with work. According to recent data from the Manpower Ministry, 1 in 3 employees experience burnout from work. It's why the ministry has partnered the Employer Federation and Union to issue an advisory on mental well-being. It recommends some practices for employers to support mental well-being at their workplaces. That includes extending the scope of medical benefits for staff. And more employers are getting on board.
Before COVID, I would say about less than 1% of the corporate customers included mental health coverage. Now, this figure has steadily increased over the years, and in 2023, it's risen to about 10%. And certainly, the pandemic had a big role to play in accelerating the awareness as well.
For this company, taking care of their employees' mental well-being goes beyond medical treatment.
We will be also offering training to a group of employee volunteers for the first time to become accredited mental health first aider. So they would be equipped with the knowledge and know-how to approach or offer help to those in need, and also guide them to the appropriate care.
The Singapore National Employers Federation is planning a series of mental wellness talks and activities this month. It's expected to reach up to 2,500 employers and employees.
Also, based on what we just saw, companies are putting in more effort to improve mental well-being of workers. Dr. Low, what would you say is the potential cost to the employer and also to the work organization when employees actually suffer from poor mental health?
Yeah, so I think there's been a change in the mindset that more companies are seeing that investment in mental health and resilience is an investment in business performance as well, especially with regards to productivity as well as staff turnover. And there's been a lot of data points out there with regards to productivity. We know that an individual with poor mental health, an individual with, let's say, overt depression, generally the productivity declines by 30 to 40%. We know for staff turnover that for companies that do not do well mentally, the turnover is exceptionally high, more than 50%. This creates a vicious cycle. The rest of the employees may feel more overworked, their mental health suffers, and then the cost with regards to recruitment, training, and all that affects the business performance greatly.
Dr. Low, you're talking about costs. A large company maybe can cover these costs, but there are costs involved in promoting mental wellness, recognizing it, I suppose managing it, cutting some slack for employees. How can small and medium-sized enterprises, which already face all sorts of cost constraints, how can they cope with these extra costs to promote mental wellness?
Yeah, with regards to that, I think generally I'll frame it with 2 points. One is they need to recognize that this investment will ultimately improve business performance and not tackling it confers some risk to their corporation with regards to business continuity as well. And I think the second one, more practically and operationally, we usually recommend for them to start small. The program does not have to be grand and fancy. They may target it at certain gaps that they identify within the company. It may be a certain aspect, maybe anxiety or stress related that they can do just for that group of employees or just for their SME. And I think the last part is to have measurable outcomes because the outcomes are a lot more visible and you can put a value to it. The ROI to these SMEs is a lot more quantifiable as well.
Well, stay right where you are, Dr. Low. We will be coming back to you in just a while, but I want to bring you through some of the other findings from that survey. It was found that nearly half of the respondents also reported depression to the point of feeling sad or hopeless almost every day for weeks at a time. And more alarmingly, over 1 in 4 of those surveyed said that they seriously considered suicide or hurting themselves at least once in the year.
And even though nearly 8 in 10 Singaporeans surveyed consider mental health important as physical health, only slightly over half believe it's treated equally by the country's healthcare system. And bring you back into the conversation, Dr. Low, how can companies better identify workers who need that help and ensure that they get the care that they need?
I think there are 2 factors here as well. So what we have always tried to advocate for is increased education, recognizing the signs and symptoms of depression, anxiety, the common psychological issues that we face, and understanding that just not being diagnosed with depression doesn't mean that we are in good mental health as well. So it's more self-initiated, self-identification. And the other one that I've seen actually gain a lot of traction through the years, and it was actually mentioned briefly just now, peer support, manager support programs. As an individual, you spend the most time outside of your family with your colleagues at work, with probably your direct manager. So these programs teach the individuals to be comfortable asking, are you okay, recognizing some subtle signs and symptoms, and then being educated to be able to direct these individuals to the appropriate care that they require as well. So I think that's something that we are really seeing gain a lot of traction with the companies in this region.
Dr. Low, thank you for your insights this evening. That was Dr. Low Kiang Wei from International SOS.